of the things I want to remind you is that this is a portal to view data. You cannot break anything, you can't add to anything, you can't delete anything by mistake. So know that this is view only. You can download and print data, but just want you to feel comfortable about navigating throughout the portal without worrying about deleting anything. So again, here's our menu. This is our clinical document tree with all the different documents. You can see there's a lot more here. And this is our, what we call patient summary. For you to be able to visualize things a little easier, I'm going to just toggle by using this tab here to move over my document tree so that you can see things a little clearer here. On the clinical summary page, you're going to notice 5 things, and I'm going to start over here with the demographics, where you'll have the patient's name, address, phone number, emergency contact, provider care. This information over here where it says risk scores summary data, that's our newest analytic program that we have available, and that is something that your organization needs to purchase as an extra product to use with your clinical portal. Moving down, we're going to have your active problems. This is on the left-hand side here. This information is sent to us by coding ICD-9, soon to be ICD-10 coding, with the onset date and then the location. Now, even though you can't really do a whole lot in the portal in regards to opening up or sending data, what you can do, if there's an asterisk here, you can hover. And that'll tell you where this information on the active problems through ICD-9s was actually captured and was sent to us. So these are all the different diagnoses. This is our allergy tab with, again, all the allergies, the reactions, the date that it was entered, and the most recent on top, and then the location, because there's an asterisk there. You can hover to say, oh, that was identified at St. Joseph's Hospital, for instance. Then we're going to move down to the prescription medication. And this information comes to us through claims data only. If a patient decides to use cash to pay for the medications, we will not have data on that. So this information is available for 120 days. And it's pretty clear, all of the information there, the drug name, quality, pharmacy, and instructions. And the last thing on the clinical portal tree is actually the encounters in the visit history. So this is where you can see the date of admission for the patient and the discharge, the visit type, whether it was an outpatient or emergency or was it an inpatient, and the service, what was actually performed. We do have occasionally able to have chief complaints, the clinician, the diagnostic category, and again with an asterisk, if you hover, it'll bring up the category of that diagnosis. Here's the diagnostic code by hovering again, and the procedure. How many patients have you seen that have gone to the emergency room and don't remember what was actually done in the emergency room? So this may help if you go down and check to see what the procedures were, and that might help to start looking for the information about that visit. And again, location by hovering gives you the information on where that patient was seen. So there it is. That is actually the patient summary screen